we're trying to change social behavior. Oral disease is the #1 preventable disease, but it afflicts most of our low-income families and marginalized communities. So to prevent the disease, we want to really reinforce education, intervention, and prevention. So once they leave the reception area, they come to the toothbrush station, and the dental assistant shows them how to properly brush, and we do it every single time that they come in, because once again we want to change social behavior.
All right, introduce yourself.
Sure, my name is Dr. Nicole McGrath-Barnes. I'm the founder and CEO of KinderSmile Foundation.
All right, can you tell me a little bit about KinderSmile?
Sure, KinderSmile Foundation is a 501c3 nonprofit organization whose mission is to provide access to oral care for the indigent population, children ages 0 to 21, which includes special needs population. We have 3 dental homes. Our first dental home was built in 2016 in Bloomfield, New Jersey, so we serve Newark, Orange, East Orange, Belleville. And in 2019, we partnered with the Boys and Girls Club of Newark. They had a dental center within their club, and we were asked to take that over. So that's another satellite dental home. And then our most recent dental home, which we built in 2020 in the thick of the pandemic, is KinderSmile Community Oral Health Center, Trenton, here located at 101 North Broad Street. Entrance is on East Hanover. And here we see adults and children because we understand the dire need to fill that gap here in the state of Trenton. So we've expanded our services not only to children and to special needs up to age 21, but for the adults as well.
Here at the Trenton area.
At only Trenton. Trenton is the only dental home that we see adults. That's how special Trenton is.
How has that been so far?
It's been absolute wonderful. We're not even here 2 years. We opened doors October 1st, 2020. And like I said, in the thick of the pandemic, and because there is such a need here in Trenton, it has taken off. The community feels extremely comfortable walking into a place that is well organized. They can have a plethora of services, from cleanings to extractions to root canals to implants, all for the community. So it's been wonderful. The only problem that we do have is our bandwidth, trying to find dental providers who want to work in Trenton to help us fill that gap. So it's very, very difficult trying to find dentists, or we call them dental providers, to come to this particular dental home to fill the need. So that has been a challenge for us. Our population demographics, we have about 48, maybe 50% Latino, and about 49 Black, and then the other percent others and white. We, like I said, we accept uninsured, underinsured, which is Medicaid and managed care. Like literally anyone could walk into this facility and get quality services. And so what we've also done was created our own platform of access to care. So I've been a dentist for 31 years. So the first 15 years of my career, I was in private practice in Essex County. And what I did with KinderSmile, I took the private practice modality, seeing patients every 30, 45 minutes, an hour, and I've implemented in this nonprofit model. Because even though the majority of our patients are marginalized from the marginalized community and are on Medicaid and managed care, we're not a Medicaid office. We don't see patients every 15 minutes. We see them every 30, 45 minutes to an hour. We want them to feel like they're at a private office. We want them to get that feeling, that sense that they're a human being, that they're not just a number, that they're a person sitting in the chair, so that we can educate them and prevent the #1 preventable disease.
Wow.
Behind her, our front desk patient coordinator,
Okay.
Mama Lou from Trenton Talks. Hi. So this is the pediatric side. So all the kids, after they finish, they have to come here and brush their teeth. So what we do, we're trying to change social behavior. Oral disease is the #1 preventable disease, but it afflicts most of our low-income families and marginalized communities. So to prevent the disease, we want to really reinforce education, intervention, and for prevention. So once they leave the reception area, they come to the toothbrush station, and the dental assistant shows them how to properly brush. And we do it every single time that they come in, because once again, we want to change social behavior. And then once they do that, then they come into this area here, and this is where they get their cleanings. Now, as you can see on the walls, we have pictures from apps, from our communities, from our partnerships, Christina Sykes Academy. So this is the oral educational room here. Everything that you see is refurbished, nothing is new. We're on a nonprofit budget, so it's not about the glitz and the glamour, it's more about educating and having a dental home for our community to receive access to care. Oral disease, the #1. If your mouth is not in order, then neither is your body, so we want to really stress that as a young age. This is our slogan, giving kids a dental head start in the community. We really, truly believe that we are here to give them a jump start. Once they have their oral health intact, they can go on to be assets to their own community. Okay.
All right. I'm wondering, how do you treat the uninsured? What is some of the packages?
Excellent.
And things
Very
available?
good question. So our uninsured population, we're about 48% of our patient population is uninsured. So for new patients, children 12 and under, first visit absolutely free. For uninsured population 12 and older, you get, and for the adults, you get a cleaning, an examination, treatment planning, and full mouth x-rays for $40. You can't go anywhere in the state of New Jersey and get that service for that amount. We also have reduced fees that are affordable fees, because we want the population to come into the dental home, feel comfortable, not that they're vying to put money for their teeth and food to make a decision. We want them to be able to walk into the dental home and have affordable dental care. So those are some of our package. We also have a membership called the Dental Savings Plan, and what that is, it is a membership, just like a gym membership. You pay an annual fee, and then you get an additional 10% off the most reduced fees.
Wow.
Yeah.
I don't think people know that you guys exist. I don't think enough people know.
I know. I think it's because, we opened up in the thick of the pandemic, and things were very, there was a lot of ambiguity. We are considered essential healthcare workers, but people had trepidations about leaving the home and contracting the viruses, and so it was very difficult to have that grandiose grand opening, but slowly but surely the community is realizing that we're here. Like I said, we have a lot of community organizations: Mill Hill, Children's Home Society, Homefront, TAS, Trenton Health Team. We're in the process of partnering with Darren Freedom Green from the Trenton Housing Authority. We partner with ARC Mercer. So we have a lot of community organizations that will help increase awareness and help to increase access to let them know that we're here.
All right. And we'll be doing our part as well.
Excellent. Thank you.
And I just want you to repeat the package just one more time, because it just sounds too good to be true.
Okay, good. And one thing I have to say, we're in the community and we're for the community. We're here. We deliberately sat up shop here, a dental home here, to be in the community, to let the community know that we're here for them. So for our uninsured package, children 12 and under, their first visit completely free if you're uninsured. For children 12 and older, including adults, cleaning, examination, full mouth x-rays, and treatment plan, $40. And then we have a dental membership plan That's an annual fee of $199, but you get an additional 10% on off of our already reduced rates. And when I say reduced rates, literally, you can't go anywhere in the state of New Jersey and get these rates. And why are our rates so low? Because we want the community to come in and be healthy, because oral health is the gateway to total health. That is number one. But also, we're a nonprofit organization, so we could not survive without our donors, our monthly donors, and our grantors. We get grants from Princeton Area Community Foundation, Delta Dental, Partners for Health. The only way we could survive is from our grants and donations, simply because the Medicaid population, the fee reimbursement is so little that if we were just to survive on that, we would not be sustainable. So anybody willing to donate PPE, gloves, masks, toothbrushes, please, we take all of that. You know, we even go to our colleagues and say, look, if you're not using a particular instrument, you know, you can donate it to us.
All right. So there you guys have it. They're here for the community. They're right on North Broad Street, but the entry
is on East Hanover, across from the cleaners.
Right downtown.
We are here for you guys. If you're Medicaid, uninsured, come on in. We have a pediatric wing, as you saw, an adult wing. You are going to be treated like you are well-deserved and get the best services here, and also here in Trenton. And over here, once they finish their getting the service done, then they come and they pick a toy. We definitely stress readings, and as you could see in the children's side, it's bright colors, it's very light. We know a lot of our kids are coming from homes from trauma, so we want when they come here they feel excited and happy about getting their teeth done. Okay. This is a closed operatory here. This is a closed operatory here that we do any fill-ins and or extractions. This is where we take x-rays. Okay. I'll go back there for a second. Oh, you want one there? Yeah, okay, yeah.
It's a nice shot over here.
Oh, that one there. Yeah. This is Kayla. Kayla's one of our dental assistants. Kayla is from Trenton. This is Mama Lou from Trenton Talks. She's doing instruments. What do you want to be on the camera? Is that what it is? In the chair there.
Okay.
And in here, this is our lead dental assistant, Edna. Edna, say hello to Mama Lou. Yeah?
How you doing?
And our dental assistants, as well as our community, are all from the Trenton community. So this is our supply closet here. We could not survive literally without donations and grants. So we do receive toothbrush and toothpaste from Task, our community partners. So once again, we treat the uninsured, underserved. We do services here such as implants at the most affordable rate. We want our community to have access to the services that otherwise they couldn't afford. Okay, so that's our supply closet there. And this is my office. This is my office in here. Okay.
All right.
So now we're going to enter the adult side. This is the adult side here. So as you can see, the adult side, little subdued colors. This is the oral hygiene bay here, where the adults get their teeth cleaned. A couple of our community partners, Task, Trenton Area Soup Kitchen, ARC, Mercer. We do treat the mentally and physically disabled. They fall under the underserved population. Children's Home Society is another one of our partners. We partner with Trenton Health Team. We partner with Henry J. Austin. We believe that the more partnerships we have, the more we can increase oral disease awareness and get everybody healthy in our marginalized communities. And as you can see on the wall on the adult side, we have great sayings because we want them to have positive affirmation while they're entering in. And we take pride in keeping the facility clean, whether you're uninsured, underinsured, private. Everyone can sit next to each other not knowing the other person's economical status. We believe that access to care is not a privilege, but it's a right. So when our patients walk in from the community, they walk into a professional, clean environment. And this is for them so that they realize that they're human beings to be treated with dignity. So always positive affirmations on the adult side.
Excellent.
This is a closed operatory here, and like I said, this is probably one of my favorite sayings here. Go into the world and do well, but most importantly, go into the world and do good. So as they're sitting in the chair, they're reading, they're being inspired by the affirmation. This is an x-ray machine that was donated by a dental provider's nephew. So like I said, we could not survive without our donations and our grants and so forth in our partnership. More positive affirmation. Good. And this is our staff room. This is our staff room in here. And we make sure that we put everybody's goals on the wall just to be supportive as a team. We have their personal goals as well as their KinderSmile goals. Okay? And we're gonna this way. Okay. So this is the lab area here. That was an article that the lab area here where we do dentures. And like so these are some of the cases that we have. Patient walks in, as you can see, all of their teeth are missing, so we're fabricating them dentures. Here in the Trenton community, we find a lot of partially and complete edentulous patients that are literally waiting on the line at the food bank and task for food, but unfortunately, guess what? They can't eat the food because they don't have teeth. So they come here and they get dentures fabricated at the most affordable rate. Like, our rates are extremely affordable, and kids 7 and under come in for their initial appointment free. For instance, we charge $40 for x-rays, exam, cleaning, and treatment planning. You can't go anywhere in the state of New Jersey and get all of those services for that affordable. So it's wanting to having the community come in and feel that they're at home. That's why we call it a dental home. Okay. Typically when the kids come in, this is an oral educational interactive app that I created about 6 years ago, and it teaches the kids how to oral hygiene. It's interactive. Let's see, let's get started. And the children come in here, and while the parents are filling out the form, the children are in the oral education learning how to brush their teeth. And it's an interactive story that reads to them. So they typically sit here and read the story before they get called in. And the characters that you see here on this interactive app are the characters that are throughout the dental home. So there's familiarity. And so a child can read it, or it can read to them. And it's also in English and in Spanish. So this is our oral educational room.